To describe depression or the type of depression that I was experiencing to someone, I would say that there is a looming darkness and doom.
For Heather B. Armstrong, depression is something she has battled most of her life.
It was in college that it became so overwhelming that I was unable to perform basic activities.
But with the help of doctors and medication, she was able to lead a normal life until her first daughter was born.
I experienced a really bad bout of postpartum depression and ended up in the hospital.
Again, with the help of medication, she was able to manage her depression. She went on to have another daughter and found professional success as a blogger and writer.
I would have bouts of sadness, but my medication was really working.
In 2015, all that changed. Heather fell into a deep depression that lasted for 18 months.
I was afraid if I sought help that people would find out.
But when she needed a refill on her medications, she had no choice but to see her psychiatrist.
He knew immediately just how bad it was. And I was sitting in his office when he said, "I have an idea and I want you to consider something."
That something was an experimental study being run at the University of Utah.
It was the first time in over 18 months that I had felt a glimmer of hope. The study is basically a very deep induced coma with anesthesia. They basically flatlined my brain for 15 minutes, and then they would bring me back up.
So every other day for the next 3 weeks, Heather underwent this very risky treatment.
This was sort of like the last-ditch effort to want to live again, and that was enough for me to take this risk.
Wow. Heather is with us this morning. First of all, how are you doing now?
I'm great, actually. I'm really, really, really good.
You look great. Walk us through what was happening through that experimental clinical trial.
So this is the first time propofol has ever been used this way. And they're trying to recreate the effects of ECT, which is electroconvulsive therapy. And they took me down, they basically took my brain to a place where I experienced no brain activity for 15 minutes. And then they would bring me back up. And to replicate ECT, you have to do it 10 to 15 times. So I had to do it 10 times.
But let's be clear here. You were only the third person to ever go through this clinical trial. I mean, how do you get the nerve to do that? Was it just so bad for you?
Yeah, I was the third person. And when my psychiatrist said to me, you know, I really want you to just consider this, it was the first time that I had felt hope in over 18 months. I convinced myself that I was never going to feel better. And he was like, I promise you this is going to be safe, and I promise it's going to work. And I was like, maybe I don't have to be sad for the rest of my life.
You mentioned your psychiatrist. We want to bring in another psychiatrist here. This is Dr. Sue Varma. Dr. Varma, come on in. And again, we should note here, you did not treat Heather. Yes. But propofol, like when most people hear propofol, they think Michael Jackson. I mean, that's the drug that ultimately helped kill Michael Jackson. Is it safe to use propofol like this?
Propofol is a very safe anesthetic that's been used for over 25 years. However, it is still a very novel treatment in the psychiatry approach for treatment-resistant depression. I think as psychiatrists and patients and families, we have to be very open. Treatment-resistant depression affects about 1/3 of the population who's actually being treated. And what that means is you've been tried on 2 or more medications from different categories for an adequate length of time, which may be 6 to 12 weeks, for an adequate dose, and it hasn't worked. And the cost to society for treatment-resistant depression, get this, is $48 billion annually. And we know that suicide and medical complications are risk factors for treatment-resistant depression. So we absolutely have to take it very seriously and be very open to new ideas.
So after going through the first few trials of this, or the first few 15-minute rounds of this, did you notice a difference?
No, I mean, I was really, really skeptical at first because it was very time-consuming. You have to fast. You know, I was fasting 20 hours 3 times a week. But it was after the 5th treatment that I woke up and couldn't understand how I could possibly have felt so bad.
Really?
Like it was like a switch got flipped in my brain.
Wow.
Yeah.
This is all of this is part of our Lessons Learned series.
Yeah.
What's the lesson here for folks who are watching at home?
I stayed alive for my kids. And I was willing to risk all of this so that I could give them back their mother. And it was worth, you know, jumping off that cliff. And so I'm so glad that I did.
Were they okay with you going through this trial?
They were. My mother and my stepfather, who are my angels. I'm not Mormon, but I will call them my blessed angels. Saved me. Yeah.
Heather B. Armstrong, thank you. Thank you so much. Dr. Varma, always good to see you. We always learn something when you're here. Heather, by the way, telling her story in her new book. It's called The Valedictorian of Being Dead. Quite the catchy title, Heather. You can learn more about it on today.com, and we will be right back.